I'm Scott Cypher, and welcome to Back in a Minute. Hi, I'm Scott Cypher, and I'm here with my good friend Mike Fleck. Mike Fleck is a personal trainer and a massage therapist. It was nice to meet you. God bless you. Yeah. So the first question I have for Mike is tell me a little bit about. You were telling me earlier that you were in a corporate environment and then it was not right for you, and then there was a young lady who said this is not the path for you. Explain to me why you do what you do and how you got there.
Well, I just like most people my age, you're kind of pushed into college and you're pushed into a career that you think that you want. And essentially what ended up happening is I was just dying of stress. I was very, very sick all the time, working 60, 70 hours a week, and it was really hurting my body. And fortunately, I got laid off my job and had some time to figure out what I wanted to do with my life or what the next step was going to be. And a person came to me at a sort of a side gig I was doing and kind of convinced me that I needed to do another path for myself. Corporate was not me, and she kind of sensed that, and she kind of directed me into the fitness world, and it instantly piqued my interest.
Almost prophetic, it was your destiny.
I didn't know that you could do something that you liked.
Right. It's like Yoda, do or do not. There's no trying.
Right. Exactly.
Yeah. So you're tell me a little bit more. You're a personal trainer and a massage therapist. What came first and all that?
So I've been a personal trainer for a very long time. I've been over 10 years at this point, and I really kind of delved into a lot of parts of it and really got interested in the mechanical part of it, the biomechanics, really helping people through, figure their journey out. For a lot of people, they would come to me, they're not really sure why they're coming to me.
Right.
They know that they're in pain. They may have been working with a physical therapist,
right,
and they were still having pain. And those were the clients I was getting from my job that I liked the most, the people that have a little bit more challenge to them. So, and I got to learn a lot from other physical therapists and chiropractors about what they were doing, and it gave me the opportunity to figure out where I can kind of grab the baton and continue their treatment, working with them. And I loved it. I really enjoyed helping people. I wasn't worrying about somebody that came in to lose 10 pounds. I was really helping people live a better life.
You were telling me something about, you did a lot of work with standing, motion, and movement. Can you tell me a little bit more about that?
Right, so a lot of functional movement screening.
Right.
Alignment's really big for me. I come in and I'm checking people's alignment. I'm checking their gait. I'm checking how their body moves, how they how they sit in a chair, how they stand up, how they walk towards you. Pretty much how their body flows. How they sit down is a big one too. Your body gives off all kinds of feedback all the time, and you just have to have somebody listen to it, because eventually somebody's going to catch hey, you may have an issue going on here that we can really address.
It's interesting your perspective about standing, because if you have a dysfunctional joint, most people are not lying down all day long. They're actually sitting or moving or having their being and everything. But this sounds like a really more like a signature of the patient, like a fingerprint of the patient.
Certainly is.
Everyone is different. Do you find that?
And you find out that a signature is the way people sit and stand, because we all have different hips and femurs and femur heads, so the way that we do things looks a little different from each other, but we got to figure out if it's right or wrong, if there is a dysfunction there, or if that's just the way that they do it.
Or even a structure. I had a friend who fell off some water slide in Belize over the weekend, and she cracked her femur. Yeah, cracked her femur, cracked her ankle in 2 places, and I don't want to be a doom or gloom or anything, but she's never going to be the same, because she's going to have actually shortness of the leg, and you had mentioned alignment. I thought that was interesting. So then you also are a massage therapist. You're a licensed, certified massage therapist and in personal training. Tell me a little bit about that.
So I found and I've always had massages. I love massages so much. I've always found that massages were always beneficial to me, but I found a limit to personal training because one thing that I'm really, really interested in is myofascial release and different types of like manual stretching, like that personal trainers shouldn't really be doing. They're not really covered to do things like that. But actually doing real myofascial release, not foam rolling, but actually releasing people's fascia and really being hands-on with someone's body rather than just verbally giving them cues all the time. You're actually like manually helping them.
So for everyone to know, so the fascia are like these two pieces of paper. They should normally be sliding past one another, right?
Right.
So if you crunch it up and like, this is going to be a lot more friction. So what you want to do is like just kind of straighten it out to get it to move a little smoother, right? Because fascia goes from your nose to your toes, doesn't it?
Right, it's in your bones.
Right.
It's inside your bones.
It goes all the way deep to the bone.
Because in the fitness world, you're always being taught, to foam roll, and all foam rolling really does is compress. And if you're compressing the fascia, it's not moving it. So you still have the same dysfunction. It's not moving. You basically want to free that fascia up. And actually, manual manipulation is the ideal way of doing it.
Makes complete sense.
Right, and you can feel the change in the skin, in the integumentary system. You can feel the change. Your body moves different when you stand up after your therapy session.
Yeah, it's sort of like I happen to be thinking about meningitis right now, and sometimes it's been said that the skin weeps for those who can't. And that's all. I know this one little baby who had meningitis, but the first sign of the meningitis erupting was through the nose. It was the virus was coming out the nose. It's really amazing. It's sort of like a puncture wound. A puncture wound, like it heals from the inside out. So this fascia thing is so important, and you're finding you combine. Is that your form of massage therapist, or are there other types of massage that you perform? Tell me a little bit about the different other than.
So there's actually.
And then the other question is, do people who like if someone were to come in who would be concerned about modesty, there's appropriate draping behind that. Yeah. And then the third thing is like different kinds of massage. You can talk about that a little bit.
Yeah. First of all, massage is a very, very it's a very personal thing, but we try to make it as safe as possible.
Right.
So whoever is on the table feels safe, and they feel protected by their therapist. There's been issues in the past that gives massage therapy a bad name. Like we don't say massage and masseur and masseuse anymore.
Amen.
It's kind of derogatory at this point, but we try to create a very safe therapeutic environment for clients and patients, because you are very vulnerable. Like the person working on you is essentially knowing a lot more about your body than you do. We're doing it in a very safe way where you feel comfortable. And there's a lot of different types of body work that we perform, from just a relaxation, like Swedish type massage, where, the biggest benefit of that is just getting into more of a parasympathetic, mode where you're more relaxed.
Yeah.
For a while I was getting a lot of that because I just needed to reduce a little bit of stress, and I'll tell you, it really does work. But when it comes to doing things like deep tissue, now deep tissue does not necessarily mean you have to basically like put my elbow into your bones.
No bruising allowed, right?
No, yeah. There's
bruise zone.
You never get a bruise when you're getting a massage. But
big bruiser, you.
All deep tissue really does mean is specific work.
Yeah.
So if you're being treated for lower lumbar issues, or if you have like IT band syndrome, I'd get in there and basically just work in those areas very specifically and carefully. And then what I'm trying to figure out is how that area is responding to how I work in that area. And normally you feel it starting to loosen up, like you're allowing me to kind of get a little bit deeper. But it never has to be painful. It's always like, if it's pain, it's therapeutic pain. It's not, you're not going to be crying or anything.
Right.
But there's purpose to the touch.
I remember a famous Dr. Carl Levitt, and he was famous, you know. And one time he had a case study where he had a patient who had headaches, just headaches. They tried every medication and nothing was working. And he found a trigger point in the calf.
I believe
that,
it.
Just the one sign that was causing the imbalance. I mean, you know, so it's almost like a life imbalance. So, but you must get a lot out of this work. You must have a strong purpose behind what you do. Right. Almost like you get more out of it than a patient.
Certainly.
Yeah.
I mean, it's nice to kind of see or hear back from a client or a patient saying, like, you know, what we did last time worked great. I felt really good. I immediately had results from body work.
So where do you see yourself in about 5 or 10 years?
So, kind of my plan at the moment is, as I'm learning all these things, I'm sort of compiling how all of these connect together. And I would certainly like to create a program that I could teach so that you can use movements and body work together. So kind of like personal training and massage therapy together.
Makes complete sense.
And then create pretty much a program for people. Like, they have homework to do, and then ultimately you just over time you're just assessing that client to make sure that they're doing the right thing. You teaching them the proper way to stretch, the proper way to do mobility exercises. But I would really like to create a program that kind of combines the two together, so people get a lot more out of it.
Yeah, almost like an individual thing. Because earlier we were watching the video of the ladies like, this will magically wave my magic wand, it'll make all the pain go away, you know. And then later, you know, you turn out, you know, they're really vague. So the specificity. I wanted to talk a little bit about I want to show actually the diagram of the thing, because it shows how, right? Do you agree? Like how
absolutely.
ergonomics and spinal biomechanics, in particular in our area, and it's all interconnected with almost like gears. So it's almost like an engineering challenge.
It is,
where you kind of
absolutely.
reverse engineering and all this stuff, the upper cross, the lower cross, is something. It's real easy to train and once you know the basics of it. But every patient has more weakness in their front muscles and more jacked up muscles in the back than others, and that's where you come in, because you're actually assessing it specifically, right?
Yeah, you're always assessing, you know, anterior pelvic tilt, posterior pelvic tilt, spinal alignments, head alignments. Yeah, you should always be looking at that.
So if there's person has all these mechanical problems, you take the pill here. How does the pill know to reverse this?
Right.
Just kidding. Okay. Is there anything else you think is important to tell the general community and the public about what you do? Anything at all?
Yeah, absolutely. I mean, it's for everybody, honestly. I mean, it's not a luxury item anymore. I mean, from people that are corporate athletes to regular athletes, I mean, everyone needs to be taken care of, on my end, their soft tissue, getting stronger, preventing diseases, preventing osteoporosis, if you have diabetes, managing your diabetes.
Right. There's
so many pathologies that you can manage a lot better just by managing your stress, your fitness. I mean, this is so easy to take care of yourself. It's not even funny, but it's just a matter of just educating yourself and getting quality education more than anything, and not relying on a gimmicky thing that you see on the internet.
Or known drugs or narcotics.
Right.
Opioid crisis we have right now with known side effects with that. And then when you think about, and I agree with you, by the way, just a little editorial, when you think about the cost of a hospital stay, right? The cost of a surgery, the cost of psychotropic drugs, you know, when you take a step back and see the trees for forest, I guess what we're both saying is like we're not saying all this is unnecessary. We got great surgeons and actually in the area. What we're saying is if you adapt a reasonably respectable lifestyle, and if you do it kind of consistently, then it's actually way more cost effective in the long run. Right, and then you reduce your
this is true
health
care.
This is wellness care, not sick care. Right?
Yeah, no, exactly.
Yeah. I think there's some system that's broken here, but it's you know.
But we're here to help people, you know, in a way that's a lot more, safe for people.
Amen, amen. Okay, so it was nice to see you. Thank you very much for the interview. I'm Scott Cypher. Join us next time, and we'll be back in a minute.